Hi, are you wondering whether online therapy would be suitable for you? Online therapy has many great benefits. First of all, it's a very convenient way of accessing therapy because you can do it, for example, from the comfort of your home. So you don't need to go anywhere to a physical location. You can just do it there where you feel the most comfortable. And then if you have had a particularly difficult session, you don't suddenly need to go and face the world afterwards. Whereas you can be in the comfort of therapy is that you can choose the therapist who you feel would be a great match to work with you. And therapy is really about this. An essential thing is the relationship and finding someone who you feel gets whatever you are going through and struggle with at the moment. So you can now choose anyone who is not even local to you. Also, if you're traveling a lot, online therapy is great because you can always access therapy even if you're not at home. And so you can. There are some times when online therapy might not work for you, and most psychologists would be quite cautious of starting to work with someone who might have quite high level of risk and support needs. If you, for example, said that you were really seriously considering harming yourself, of course, if you are somewhere miles and miles away, even thousands of miles away, it would be really difficult for a professional help you actually physically get you support there and then. And so in that case, face-to-face work might be more beneficial for you. What kind of equipment is actually needed for online therapy? You need a good enough online Wi-Fi network. If you are, usually a good test is that if you're able to watch YouTube videos without problems, or maybe Netflix, you're watching films without problems, and the connection dropping all the time, then that's usually quite a good indicator that online therapy might work as well. Often it's quite good to have those little earpiece so that you are able to hear better, but noise is not necessary, but at least it sort of cuts all the background noise if there is, and it would be really, it's important that you find somewhere where it's confidential. So doing it, for example, from a coffee shop probably wouldn't be such a great idea because you wouldn't be able to relax there. But if you're at home and then you're on your own, so you know that there's no one going to be disturbing you during that time, that would be a great idea to have confidential time and place just for you. So if you have, for example, small kids at home, it's probably not the most relaxing time, and you probably wouldn't be able to really kind of get in touch with what you're going through. So it's probably better to find a babysitter and actually have face-to-face work. And then technology-wise, I tend to use Zoom, which is this online platform, and it's secure. It's very easy to use, so you need to have that certain level of confidence with technology and not to be scared of it. Even if you don't know everything, it's Zoom is quite easy to install, and basically what it means that for example, how I do it is that I'll create a session link and then I'll email it, and you would be just able to follow that link, and you need to register, you need some details like your email address and things like that, and as you then click on the link, it will the connection will open, and we will be able to start. So I hope that this gave you some sort of indication whether online therapy might work for you, and do get in touch if you have any further question. I'm always happy to help, and bye for now.